had someone reach out to me and say that there's no such thing as long COVID, that's just something that they've made up because people were permanently injured by blood clotting because they were denied treatment in order to protect the emergency use authorization. Is that valid? And if so, can you speak to it?
You know, the term long COVID has been used to describe post flu that has been identified with, of course, the fake PCR test that was recalled by the CDC itself last year. But they're still diagnosing it and going ahead with it. And long COVID is this name that's applied to residual symptoms that are being tied back to the flu from 2020, 2021. We really don't know for sure. You can get a different answer depending on which expert you ask. I'm not sure what it's about. I do think that the C-19 flu was part of a gain of function effort and program. And so I think what was spreading and making people sick in 2020 and 2021 was definitely part of that program. We don't know what we have now and mixed in with the normal flu. So I would just say to people, find a doctor that you trust, not one that's going to push you toward these jabs, not one that's going to, brush you off. And there are very few of them right now, Dr. Gina, but I would say find a treating provider, nurse practitioner or physician who's not on the Kool-Aid train and get some help to prevent the extension of these symptoms and get yourself in better shape. We really don't know what it is.
If this is true that telling people go home and take a Tylenol, as they did in many cases of people with COVID, rather than treating them with many of the treatments that were out there and perfectly available, but the government was shutting them down in terms of Fauci and others, isn't this willful injury on a mass scale to protect what is essentially a corrupt pharmaceutical cartel against the American people?
Yeah, absolutely, Dr. Gina. And in fact, good doctors, the few that are left, are treating people who had a COVID-like flu later on and who have these residual symptoms. They're treating them with ivermectin and hydroxychloroquine. And they're having great success with it as well. I think what's happening in these shots, we do know that there are different things, different contents at different times. And so people are getting sick in many different ways. It's actually the perfect crime. And then as you mentioned at the top, it's really interesting to note that what pharma is basically doing is they're creating illnesses, injury, and disease, and then they've got a solution. Pfizer's coming out with its pills and its anticoagulants, and it's just a merry-go-round that I hope people realize they have to get off of, right?
Yeah.